Good afternoon. Take your seat, please. Your Dr. Sehrish.
So my name is serish Mehraj and I live in district Srinagar. I have pursued my basic education from Tiny Heart School and
तो आपसे पूछा ही नहीं क्या बता दीजिए आप पहले ही शुरू होगी. What does Sehrish mean?
so it means the first ray of sun. First ray of sun.
First
Ray of sun.
ray of sun.
Yes, sir.
Why you want to become a civil servant after becoming a doctor?
Sir,
Do you
actually,
have some other Sehrish in mind?
no, sir. So actually, in 2017, there was a murder case in my locality.
Oh yeah, relax. Come on, man.
सेंटिमेंटल नहीं होना है. पानी पियो पानी दे बेटे.
अल्लाह ताला आपको हिम्मत दे, मुझे मग़फ़िरत करे.
2017
Yes, sir.
जिंदगी में बड़ी बड़ी मुसीबत आ जाते हैं, सारा ऊपर वाले ने लिखा होता है. You have to fight it out and face it out very boldly. You are a bold girl जिसने मेडिकल पढ़ा है, डॉक्टर बन गई है और डॉक्टर बनने के बाद अब सिविल सर्विसेज में आना चाहती है.
You will get a lot of pressures and problems once you become a civil servant.
बिल्कुल.
Not even a doctor.
So you have to, that you have to at that time handle that.
You're such a good girl. You just be emotionally strong. You will handle every difficulty that will come.
So actually, the subject of parents is such that you get emotional.
But you touched it yourself. Nobody asked you about your.
So because
Okay.
चलो रिलैक्स. टेक इट इजी.
Have some water and we'll go.
yes, sir.
चलो मैं आपको इंट्रोडक्शन के बारे में कुछ पूछता हूँ.
Yes, sir.
हैव यू हर्ड अबाउट एस्केलेटर इंटरव्यू?
No, sir.
एस्केलेटर इंटरव्यू होता है जी, अगर आप इलॉन मस्क को मिलेंगे एस्केलेटर में, मेट्रो के एस्केलेटर में मिलेंगे, सो यू गेट ओनली 2 minutes. एस्केलेटर ऊपर जाने में कितना टाइम लगेगा, नीचे जाने में कितना टाइम लगेगा? तो उन 2 मिनट में आपको अपने आप को मार्केट करना है. दैट्स कॉल्ड एस्केलेटर इंटरव्यू. तो आप अपने 2 मिनट में एस्केलेटर इंटरव्यू दे दो अपना. इंट्रोड्यूस योरसेल्फ. 2 minutes.
Sir, I have done my bachelor's in medicine and surgery from Government Medical College Srinagar, and I'm currently working as a resident doctor in Safa Marwa Hospital. And my hobbies are feeding stray animals and rescuing them. Yes.
2 मिनट नहीं हुए भाई. पानी.
नौशहरा किस बात के लिए?
Sir, Naushara, the shrine of Sir Habibullah Navshari.
Any other prospect Nowshera?
Naushara.
Now, share.
So it was actually on the outskirts of Srinagar initially, and that is why it came to be known as the new city.
New city. It was called. It was once the capital of Kashmir also. It was a city given the name of Nowshera, New Shahra. Then it was the capital of. मुझे आप एक चीज बोलिए. नौशहरा में इस टाइम बिस्किट में इसके बगैर कौन सी ज़ियारत मशहूर है आपकी बिस्किट की वजह से?
Sir, the shrine of Sir Jinab Sahab shrine. Yes, sir.
जिनाब साहब is on the banks of
Sir Anchar Lake.
Anchar Lake का एरिया आपको पता है कितना? Do you think that Anchar Lake is dying lake?
Yes, sir.
Why?
So because of increased pollution in the Anchar Lake due to the effluents from the Skims hospital, so it is very polluted at this moment. So and due to encroachments.
But as a civil servant tomorrow you are given the charge to clean this
Lake.
Yes.
So it's fast. That's still doing. What steps will be taken?
So the first step is so that we'll prevent the encroachment if there is any illegal settlements which there, so we can just allot them some other place. And so the second thing that we can do is that we can take steps for sewage treatment of the effluents from skims. So
वो क्या कर सकते हैं? Encroachment ठीक है, you that What about educating the people regarding this?
So yes, so awareness about the benefits of
Benefits
of the lake, of the biodiversity in the lake, and the cultivation of bamboo shoots in the lake. Like we can tell them about the economic aspects of preserving the lake.
You are from the medical faculty.
Yes, sir.
You have a famous Sikkims.
Yes. Yes, sir.
That's the territory.
Yeah.
Is that hospital a government hospital or a trust?
So it is a government hospital, but the university is a deemed university, and it is under the and the chairman are the Lieutenant Governor of Jammu and Kashmir.
When it happened, it was a trust only.
Yes, sir.
When it happened. When it was taken over the government, the trust was taken.
So I don't.
It was during Mufti Saab's time, when Mufti Muhammad Said was the chief minister of the state. The control of this hospital was taken by the government. Can you tell me anything about the political happenings going on in Maharashtra at present?
So there is the issue of how horse trading in the between the Ajit Pawar and Sharad Pawar, so their party, and they are currently arguing about who will take the election symbol. So
Why that has happened when the Eknath Shinde was having already absolute majority, government was running with majority. Why they were supposed to go for this?
So because of the
Party, what was the reason? What were the reasons for?
so inclination towards different ideologies was the reason.
Only this was the reason. Wasn't there any direction, judgment from the Supreme Court which has forced them to go for such activity? We are not clear.
ये इंटरेस्ट आपकी पॉलिटिक्स में नहीं है कुछ?
Sir,
ये आप सही बोलो, हाँ ना
sir, no.
G20 जो, what is G20?
So it is a grouping of 20 nations around the world, and their main main motto is about the economic development and the stability of the
Who is the
country.
president of the group right now?
So it is India.
And which country headed it prior to India?
Indonesia, I guess.
बाली में थी ना पिछली
Yes,
मीटिंग
yes, sir.
G20 की, तो वहीं पे इंडिया को प्रेसिडेंसी मिली। SCO, have you heard of it?
Yes, sir.
What is that?
Shanghai Cooperation Organization.
उसकी अभी रिसेंटली एक मीटिंग हो गई, was in virtual mode.
Yes, sir.
कहाँ किसने चेयर की थी?
Sir, Prime Minister Narendra Modi.
Can you tell us something about that meeting and
Outcome.
Sir, the meeting was held virtually in New Delhi and presided by Prime Minister Narendra Modi. Sir, and the members of the meeting were Russia, China, Sir, Kyrgyzstan, Kazakhstan, Uzbekistan, and there was an induction of Iran into the meeting as a newest member of SCO. So, and the issues raised were on they were on radicalism, sir, and they were on radicalism and terrorism in the region.
so what is the issue between Russia and Ukraine?
So the issue between Russia and Ukraine, that is the the Ukraine as a separate nation that threatens the sovereignty of, according to Russia, that threatens the sovereignty of Russia as it is a part of the it is trying to be a part of the NATO. So Russia thinks that it will act as a deterrent to its security because of its close links with the European Union.
Coming to your subject, you are a doctor. What are the problems our health sector is facing?
So So the current problems that the health sector is facing, so it is that, so firstly the issue with doctor patient ratio, so it is very less as compared to as what WHO has given. So and the another issue is that there is lack of proper healthcare in the peripheral areas. So so there is a lack of proper special, like they do have physicians there, but they do not have surgeons or gynecologists available in the peripheries, for which the patients are referred to the tertiary hospitals, increasing the burden of these hospitals. So that is another issue, and the substandard drugs, that is also a big issue.
Biomedical waste disposal का क्या mechanism है?
So it is done as there is the chance of disease, the spreading of the disease. So the waste that needs to be properly treated so that the diseases are not spread into the environment. We have different methods of treating the waste. We can either treat it chemically, or we can treat it so by burning it, incinerating it, or by autoclaving it, and then that is then dumped into the soil.
How is it disposed of? यहाँ separation होती है biomedical waste?
Yes, sir, that is separated. There are different containers for the separation of the waste. We have a yellow, we have a yellow bin for the separation of human tissue.
Do we have incinerators in all the hospitals over here?
So it is present in SMHS and in SKIMS. So it is present there.
आपके ऑप्शनल मेडिकल साइंस?
Yes, sir.
ओके, आप मुझे बताएं, रिसेंटली अ न्यू डिवाइस हैज कम इन द मार्केट दैट्स अ रिप्लेसमेंट ऑफ स्टेथोस्कोप. Heard about it?
No.
But it's
No, sir.
it has gone viral. Butterfly IQ. It can conduct your ultrasound. It can do a lot of things. It is a complete replacement of the stethoscope. आपने नहीं सुना है वो? रोबोटिक सर्जरी के बारे में बताएं, क्या होता है? What's it?
So robotic surgery is basically an AI application into the medical science, where the surgeries, they are not conducted by the human hands, but they are conducted by the trocars of a robotic instrument. So and it leads to high precision in the minimalization of the human errors in the surgery.
What is MIS?
Minimally invasive surgery.
MIS and laser go hand in hand, or it is a subset of robotic surgery?
It is a subset
Of robotic surgery.
Yes, sir.
Okay, biomedical waste का तो लोन साहब ने पूछा आपको. You heard about Durand line? Durand line.
Yes, sir.
क्या किन कंट्रीज को डिवाइड करती है?
So it divides China and India.
That's McMahon line. Durand line separates Afghanistan and Pakistan. What is the problem in Afghanistan right now? Why is that government not being recognized?
So that government is not being recognized because it is not being recognized because they did not get enough votes in the UN, sir, and that.
Take your time, is easy.
So that government was not recognized by the UN
because
members.
of their poor women right record.
Yes, sir.
They are not being recognized. GATT के बारे में सुना? GATT.
Yes, sir.
क्या होता है जी?
I cannot recall.
OPEC के बारे में सुना? OPEC.
Yes, sir. So.
Organization of Petroleum Exporting
Yes,
Countries.
sir.
GATT is General Agreement for Trade and Tariff.
Yes.
G20 के बारे में सुना अभी?
Yes.
SCO का हेडक्वार्टर कहाँ पे है?
So it's in Beijing.
Okay, thank you.
Yes, sir. So about animal rescue, so I work with some NGOs which are on Instagram, like Animal Rescue Kashmir. So if I just see any animal, if I'm on my way to my hospital, and if I see any animal, and I just carry some dog food or cat food in my car, and I feed them. Whenever I see an animal, I feed them, and I send donations to the organization for the rescue of the animals as well. And sometimes I may pick the animal myself and drop at the hospital.
So, is there any global level body dealing with such?
So it is PETA.
Were there any problems also with PETA?
So problems with PETA. So there were some issues with PETA recently, and
Okay. We have which body here in this state having the responsibility, like if there's a working NS or there's a state official. Okay, so which body is dealing with?
So it is the state, it is the SPCOs. They are the bodies governing the prevention of cruelty to animals. And so there are also some district committees under the divisional commissioner's office. So district animal welfare committees. Yes, sir.
What's the favorite thing?
So that would be chocolate cake.
Chocolate cake.
Yes, sir.
Okay. So if medical science is connected to baking,
Yes, sir.
calories required, say for example in midday meal scheme. So how will you be using this baking hobby of yours if you are selected?
So actually the calorific value of the cake is very high. So personally it should not be kept in the midday meal scheme. It is so.
So if I need to ask that, which crop you will use to cater for most of the life? On the one hand, nutritional values, and on the other hand, price and affordability, and also the adequate availability.
So the perfect food for that is the dal rice thali. So which has adequate amounts of carbohydrate in the rice and the proteins in the pulses. So that is and so that also contains all the essential proteins that our body needs.
And what about millet? We are hearing so much, especially for African countries.
Year of millets.
Yes, sir. So that is the poor man's pulses. So they are easy to grow in arid and semi-arid areas. They are easily available in India, and they can also be pulses can also be substituted by the millets.
Right, serish.
बेटा आफ्टर 14 अगस्त को है इंटरव्यू, हाँ?
Yes.
अभी है काफी टाइम। एक बार आप यहाँ पे आएंगी और फिर but keep yourself emotionally very strong.
Yes, sir.
Play a negative role in your
Yes, sir.
बाकी you are doing well. डॉक्टर है, you have grown your
brave.
4th पोजीशन आपकी 12th में थी. That means
Amazing academic record.
सारा रिकॉर्ड ठीक है और मेंस क्वालिफाई किया है. That means यहाँ भी आपने ठीक कर दिया है. तो इंशाल्लाह you will make it, but थोड़ा सा रहो emotionally strong.
Yes, sir. So
Medicine as
काम
optional.
दे रहे हैं आपको सैलरी ये सभा बार होगा. हाँ?
So it's the scenario in every private hospital in
ये
Kashmir.
14-15,000 दे रहे हैं.
Yes, so maximum they can give up to 20, not more than that.
सभा मतलब होगा ना हमारे स्कूल
Lunch was not done, 14,000 total divided.
हम हैं हमारा इंडियन डॉक्टर
All the best, beta. We will meet you again. तो फिर
Yes, sir. Thank you, sir.